Let's see about pericoronitis. So pericoronitis, it is the most common condition in dentistry. Synonyms for this condition is operculitis or pericoronal infection. So operculitis or pericoronitis. So what is the definition for pericoronitis? So it is an acute infection. It's very important. It is an acute infection which refers to inflammation of gingiva and surrounding soft tissues of an incompletely erupted tooth. It occurs most frequently in the mandibular third molar area. So the key points are: it is an acute infection, an inflammation of the gingiva and surrounding soft tissue of an incompletely erupted tooth, and it is most frequently in the mandibular third molar area. And what is the types of pericoronitis? Acute pericoronitis, subacute pericoronitis and chronic pericoronitis. Acute pericoronitis, subacute pericoronitis and chronic pericoronitis. What is the etiology for this condition? So the first one is a partially erupted tooth covered partially by a pericoronal flap. So it may get infected by the accumulation of the food debris between the flap and the surface of the crown. So the accumulation of the food debris between the flap and the surface of the crown produces inflammation of the pericoronal flap. So this is the cause for the pericoronitis. And the second one is eruption of the tooth itself may produce some amount of inflammation of the pericoronal region. And the third one is trauma to this inflamed swollen flap from an upper tooth may aggravate the problem. So trauma to the inflamed swollen flap by the upper tooth and inadequate attached gingiva. So this leads to the pocket formation around the erupting tooth. So inflammation of the periodontal pocket may lead to pericoronal infection. So these are the etiology for pericoronitis. One is partially erupted tooth that covered the pericoronal flap. It infected by the accumulation of the food debris, and the eruption of the tooth itself may produce some amount of inflammation, and trauma and inadequate attached gingiva produce pocket formation. Next, moving on to clinical features. The first one is signs. What are the signs? Pain and swelling in the involved region and pus discharge from the under the pericoronal flap, and there may be associated trismus if the lower third molar is involved, and indentation from the upper tooth trauma may be seen on the pericoronal flap. These are the signs for pericoronitis. What are the symptoms? Patient may complain of fever and malaise, and there is a regional lymph node enlargement, and tooth may be tender on percussion. There is TOP is present, maybe, and edema is visible in both submandibular area and peritonsillar area. So these are the symptoms for pericoronitis: fever and lymph node enlargement, maybe TOP is present, and edema in both the submandibular area and peritonsillar area. Next, moving on to complication of pericoronitis. So the involvement may become localized in the form of the pericoronal abscess. So pericoronitis leads to pericoronal abscess, and it may spread posteriorly into the oropharyngeal area and medially into the base of the tongue, and making difficulty for the patient to swallowing. So these are the complication. And another one is it occurs in partly erupted vital tooth, so it may give rise to the cyst formation. And depending on the severity, there may be the involvement of the submaxillary, cervical, deep cervical and retropharyngeal lymph node. And other complications are cellulitis, Ludwig's angina and peritonsillar abscess formation, or potential sequel of the acute pericoronitis. These are the complications of the pericoronitis. And next, moving on to management. So what are the treatment for pericoronitis? The treatment of pericoronitis depends on the severity of the inflammation and systemic complication and advisability of retaining the involved tooth. So the first visit for pericoronitis, So we have to examine the severity of the involvement of the adjacent substructure and toxic systemic complication. And next step is area is gently flushed with warm water to remove superficial debris and surface exudate. So we have to flush with warm water and we have to apply the topical anesthetic. And if the infection has spread to the adjacent vestibule, we have to do incision and drainage of the pus may be done. And the area is swabbed with antiseptic and the flap is gently elevated from the tooth with a scaler. So the underlying debris is removed and the area is flushed with warm water. And extensive curettage or surgical procedure are contraindicated in initial visits is very important. So extensive curettage or surgical procedure are contraindicated in initial visits. We only do remove the debris and clean that area. It is an initial procedure that we do in first step. What are the instruction we have to give the patient after first appointment? So first one is thoroughly rinse with solution of salt with warm water and copious fluid intake and rest, and antibiotics. If any systemic complication is present, give antibiotics, and patient is informed to return in 24 hours. These are the instruction we have to give the patient after first visit. And the second visit, after 24 hours, the patient condition is definitely improved. So if the drain had been inserted, it should be removed and the flap is gently separated from the tooth and the area is flushed with warm water. And the patient is told to continue with the instruction of previous day and to return in 24 hours. This is the second visit. If drain had been inserted, it should be removed and we do flap is separated and flushed with warm water. Same procedure in first sitting. And the third visit, once the acute condition is subsides, the impacted tooth may be either be extracted or the pericoronal flap may be excised. So to reduce the risk of the bone loss around the second molars, partially or completely impacted third molar should be extracted as early as possible in their development. So if you want to reduce the risk of bone loss, you have to extract the third molar. If it is decided to retain the tooth, so necessary surgical procedure are performed at this visit provided that there are no acute symptoms. And what is operculectomy? Operculum, it is a dense fibrous flap which covers about 50% of the occlusal surface of a completely or partially erupted mandibular third molar. So the removal of this flap is known as operculectomy. So operculum, it is a dense fibrous flap that is covered 50%, above 50% of the occlusal surface of a completely or partially erupted mandibular third molar is called operculum. If we remove that flap, it is operculectomy. So this picture showing there is a flap, dense fibrous flap that covering the completely erupted molar. So it is that flap is called operculum. So this picture showing we have to check with a periodontal probe using we have to identify there is any infection and pocket formation is present or not. And this is the procedure of operculectomy. In the first and third picture, there is a presence of flap that covering the tooth, and the second and fourth picture after removal of the operculum or flap. This is the procedure of operculectomy. So it is not easy to remove this flap as the tissue are freely movable and slides away beneath the usual scalpel or scissor. So this flap can be best removed with the help of electrosurgical scalpel or radiosurgical loop. So it is best removed by the electrosurgical scalpel or radiosurgical loop. And next treatment procedure is periodontal surgery. Surgical procedure are performed using periodontal knife or electrosurgery. So we are using periodontal surgery, periodontal knife or electrosurgery. So we have to give anesthesia. Under anesthesia, a wedge-shaped incision is made to section the tissue that include the gingival flap with the tissue distal to the involved tooth as well. So after the tissue is removed, a periodontal pack is placed. So this is the procedure of periodontal surgery. So in pericoronitis, first initially we don't do any surgical procedure.